This is a webcast on headaches. Like I've said in all my other webcasts, is that this is by no means a substitution for a qualified medical exam. If by chance you have headaches or any other type of injury, you should really go see a medical provider for some type of examination and make sure it's not anything serious. In all seriousness, this can be anything. It can be nutritional. It can be an issue with blood pressure. It can be a lot of things. The thing I'm going to talk about today is its correlation with tightness of the neck, stress in the neck, and pain that actually some people feel along their eyeballs here. So I want to make sure that, like I said, this is for educational purposes only. I hope you learned something from it, and please see your medical doctor or a qualified medical provider for some type of examination. Okay, so the types of headaches I really want to talk about today are induced by the neck tightness and spasm. And the thing I really see with it is that a lot of people don't seem to correlate the tightness in their neck with their headaches. And I know a lot of people come in and talk to me about their migraines and how they've dealt with headaches for years. And really, a lot of times I see it's referred pain. It's referred pain from the muscles of the neck. They're really tight, and actually they spanned out. And although you might have issues down here with tightness, you actually have presentation of the problem up into here and up and around the ear. And I can honestly tell you, and you should look this up online to make sure I'm not making it up, is there's a nerve called the greater occipital nerve. Actually, it's in the back part. It's in the very high part of the neck, right up into here. It goes through something called the suboccipital triangle. And actually what you have with the triangle, there's small tiny muscles. So small tiny muscles have a tendency of having overuse injuries, especially say if you're cocked in this position a lot, or your desk work. A lot of the times they get them, or stressed out. A lot of times ladies have issues with stress. A lot of these can actually cause overuse injuries in these muscles. So I'll show you what happens though with the triangle. So here what you have, let's just imagine this with the spine. Let's just go with the spine this way. Okay? So what you have is, on either sides of the neck there's actually a triangle. There's a triangle of muscles that go like this. Okay? Either side. So these are very tiny, they're small, but through it, and I'll show you on myself, through it comes a huge nerve. It's about the size of a piece of spaghetti. After we've been doing the human dissection, you can see it. It comes out, and actually it can stick on these muscles right here. And if it sticks on it, it reduces slide, it reduces function of that nerve, and it can cause things like headaches into the, it almost feels like it's behind the eye. But here on me, I'll show you. So you have the suboccipital triangle right here, and the greater occipital nerve actually goes up and over this way and actually drops right behind the eye on either side. So I want to make sure that if you have this type of condition and you haven't responded to some type of medication, you should really consider trying something out to free up that nerve from those surrounding muscles. So if you have an athlete, imagine this as an athlete first, because this will give you a better way of visualizing it. So if you have a muscle, sorry, the marker's dry. We'll go a little closer here. So if you have a muscle, it strips like this. And if you're an athlete, or if you have a big tear, you have a big tear that goes up like this. So it's a gigantic one. Okay? Now that's not the case with overuse injuries or things where you don't remember it happening. Usually they're smaller tears. They're small, they're tiny. They're called microtrauma, they're called micro tears. So these muscles actually, there's a gap in there and it fills up. The body fills it with scar tissue or fibrosis or fibroblasts. So this makes this a different consistency of these surrounding muscles. So really what happens here is that next time you overuse this muscle, it rips again. And it fills, and it rips, and it fills, and eventually you get, if I ever got any marker, is that you have a big ball of tissue. You have a big ball of hardness in there. So a lot of times when the ladies are like, well, it feels like tightness, I feel these knots in the back of my neck. This is what they're feeling. And a lot of times this is what can cause an entrapment of that nerve as it goes right past. So again, we're talking about the greater occipital nerve going through a bundle of scar tissue inside the suboccipital triangle. So a lot of times what you need is someone to go in there and actually break it up. So you got to get in there specifically with your thumb and break this tissue up and free that nerve up from the surrounding tissues. I don't want you to actually go in there and break that stuff up yourself. That's not the intent of this video. It's purely educational. But if you have that, if you feel like this pertains to you, you should really go get an exam done. If you go to someone who's qualified in treatment of the soft tissues, that's probably best. Personally, I think if you find an active release provider or ART, that's probably your best way to go, because a lot of times these muscles are very small and hard to find. With ART, there's over 500 different protocols for the whole body, and you can providers that do ART can specifically go in there, find these muscles, and treat them more effectively than a lot of other people who aren't educated in these regions. So active release basically it breaks up that scar tissue. Like I said, it frees up the nerve. Usually you find a rapid decrease in symptoms, even if you've had symptoms or headaches for years. If it's going to work very quickly.
Don't forget to check out our ebook at the website below.